Good morning, everyone. Thank you for joining us for the COVID-19 and the nervous system presentation. Our presenter is Dr. Reyes with the Carol Hayden VA Medical Center. If you guys have any questions, go ahead and leave them in the chat box, and we'll try to get to as many of them as possible. If you have any questions for me, my name is Kiki. I am the facilitator, and I'll be glad to help you guys. You're okay to start, Doctor.
However, he needs to unmute. Go down to the left. There you go.
Can you hear me?
Yes, we can. Thank you.
Good morning, and thank you for joining us this morning on our discussion COVID-19 and the nervous system, during which we will discuss acute and chronic neurological complications. Just give you a little historical background. Our health institution began in 1887 as a hygienic laboratory. We had the pandemic in 1918, and you can see here wives of servicemen and also some civilian women volunteering to make face masks during the pandemic. And during this time, there was also this First World War. And in 1946, we had the Communicable Disease Center, which became the CDC. In the early part of the pandemic last year, we have the servicemen and women of our military involved in the preparation of goods, delivering different types of PPE, and also vaccinating people and treating victims of COVID-19. Why are we talking about the neurological complications of COVID-19? We now know that COVID-19 does not only affect the lungs. There are significant signs and symptoms and even death associated with involvement of the nervous system. If one looks at the presenting manifestations of COVID-19, there is no question that the nervous system is involved. When we talk about this nervous system, we talk about the brain, the spinal cord, the nerves, and the muscles. A lot of patients with COVID-19 present with headaches. Some lose the sense of smell and taste. Some have confusion, muscle aches, weakness, and more recently, we are finding out strokes. Another issue that I have been reminding my colleagues that COVID-19 can have long-term complications due to damage in the central nervous system, such as depression, dementia, seizures, and what my patients call brain fog. Now, some recent studies have shown that most hospitalized patients with COVID-19 have neurologic symptoms. And these symptoms can last even after they leave the hospital. And fortunately, recent studies have also shown that COVID-19 is affecting more children and young adults. Now, viruses and the nervous system are well known to us as doctors and healthcare providers. If you look at the slides on the left, you can see that there's blood in this brain. And by the CAT scan, you see this dark shadow here. This is a typical brain involvement in patients with herpes. Okay, one of the viruses that tends to attack the nervous system. Now, what we're talking today are viruses, in particular coronavirus. Viruses are obligate intracellular parasites. That means that viruses cannot replicate on their own. They have to infect a cell, like a human cell, in order to produce or reproduce, killing the cells that are infected. For instance, this bat has the coronavirus, and it has to infect brain cells or lung cells or heart cells to be able to reproduce. What are coronaviruses? What are the coronaviruses that cause disease? It's really a large family of viruses, mostly found among animals like pig, camel, bat, and cats, and other animals. Many of them cause mild symptoms of coughing or respiratory tract or lung infections. Actually, the first four coronaviruses that affect humans cause flu-like symptoms. So some of us probably have already had antibodies to the first coronaviruses. However, during the last 3 decades, 3 coronaviruses have caused severe respiratory infections, such as pneumonia, that can cause death or complications in the nervous system, the heart, the kidneys, the liver. And the first one occurred in China too, in 2002 to 2004. The Middle East in 2012, that lasted until 2014, came from a camel. And the one that we're facing, the pandemic, is caused by another coronavirus called coronavirus 2. And evidence indicates that they may have come from bats. And what another animal is called pangolin. Now, I'm one of the few neurologists and neuropathologists in the country, so I do both neurology and pathology of the brain examination. So if, as a pathologist, we look at this virus here under the electron microscope, this is a very specialized microscope that we use to identify the virus. And if you draw this virus in a cartoon, this is how it looks. It has spikes around the virus, the membrane, and this is called spike protein. And this spike protein is the one that wreaks havoc on different parts of the body, the lungs, the brain, the kidneys, the liver, and the heart. And so knowing this, that this is the one responsible for the damage, we now have antibodies, and I'll explain that to you later on, that neutralizes or not neutralize this spike protein. Now, these are very tiny organisms, and so we have to utilize very special devices or equipment such as electron microscope. Now, how does the virus enter the body? Through the blood, through the mouth or oral cavity, inhalation, skin, and I'll show you later on how the nerves become a pathway for those viruses. For this reason, we advocate strict social distancing, wearing masks, and frequent washing to prevent or decrease the transmission of this virus. Now, looking at the manifestations or the signs and symptoms of COVID-19, patients, many of them or most of them develop fever. And look at this, the loss of appetite, fatigue, loss of smell and taste, shortness of breath, coughing, muscle aches, and pain. In severe cases, they are unable to walk, there's confusion, there's bluish discoloration of the face or lips because of the lack of oxygen, because of lung problem, coughing, sometimes with blood, chest pain, and if you look at the laboratory, examine the blood, there is decreased white blood cells, and that could be all kinds of involvement in the brain, the heart, and the kidneys, and there may be high fever. Just on the right side, look at this. This is the normal lung, all right? It's like a sponge. And you see here, look at the heart. It's small, But in a COVID-19 patient, look at this, it's black. It's hard. Look at the heart here, how big it is. So it is working very hard to supply the brain to different body parts. If you look a piece of this lung and look at under the microscope, this is what you see. There's blood, there's a lot of this inflammatory cells, there's swelling, and there is dead tissue. Now, fortunately, whoever made us made sure that we have an innate immune system that prevents us, counteracts the offending agents like viruses and bacteria, and prevent us from infection. That's why many of us do not suffer from symptoms of COVID-19, because our immune system fights the virus. And these are the adenoids or tonsils, the bone marrow, the thymus gland, the lymph node, spleen, and some parts of the intestine and the appendix. And to exemplify this is when we have, say, a wound in the leg or arm, we have a little painful nodule in the armpit or in the groin. And that's because these lymph nodes are fighting that infection. They're swollen. All right. So what happens in the body, inside the body? As a doctor for the VA, and I work with the Department of Defense as well, these are what I call the Marines. These are called macrophages. These are white blood cells. And these are the first one to neutralize the virus or any infectious agent. When these macrophages are overwhelmed, then they call other cells, immune cells, T cells and the B cells. There are different types and different roles to play. And these cells are, the B cells are the ones that produce antibodies that neutralize the virus or any offending organism. The T cells help also kill those viruses. The memory cells can be B cell or T cell, and they are on the guard for new infection. So if we have immunity, these memory cells will attack that virus that may reinfect us, because they're there. They know the shape, the size, and the type of the virus. Now, the immune system is sort of the vanguard, the first line of defense. So it produces cells. I talked to you about macrophages, B cells, and T cells. And these cells, the immune cells, produce some chemicals called cytokines. And so they activate the process of inflammation. But if these immune cells go into high drive, or overdrive rather, there can be problems too. So when the immune system gets into an overdrive, one can have very high fever, swelling, redness, extreme fatigue, and nausea, and organ failure. So everything fails: the lungs, the brain, the heart, and the kidney. And that's what we call multiple organ failure. Unfortunately, some patients develop that, and that usually, or that can lead to death. This is how we measure those chemicals, the chemicals that we measure to determine the presence of the overdrive immune system. And that's what we call the cytokine storm. So to remind us that this is not normal anymore, there is excessive reaction of the immune system. All right. Then we go now, how does the brain get involved in COVID-19? Okay. there are different pathways, okay? When the virus enters the blood and they multiply and multiply, and there's enough or many of them, and it targets the lungs, then there's lack of oxygen. The virus circulates around and infects different organs like the brain. Then when the lungs fail, there's a lack of oxygen in the brain, and that's called hypoxia. And the brain doesn't tolerate for a long time lack of oxygen. It's highly dependent on oxygen. And so the blood vessels in the brain, as you can see here, I'll show you. These are the small and tiny blood vessels in the brain, preventing viruses and bacteria in normal conditions from entering the brain. But when there is lack of oxygen, this swells up. It opens up, and then the virus can enter the brain. And what happens? It can cause meningitis, encephalitis. Another way that the brain can be involved is when the lungs fail and there's lack of oxygen, the brain cells swell up, okay? And look at this lung. If we cut the lung of a COVID-19 patient, there's hemorrhage, and this is the normal, very soft, and you can feel the crepitus or like a sponge, but here is already solid. And the brain will suffer from lack of oxygen. What happens? There is swelling, there is congestion, and the blood vessels open up. And this is what happens to the brain. The brain function and is diminished or is arrested. And if you look at the MRI, look at this white stuff. These are all damage to the brain due to lack of oxygen. Now, as a pathologist, when we examine the brains, they're swollen. And look at this here. Instead of being filled with brain tissue, there are now holes in the brain, indicating that there's a lot of water and swelling. Okay. Another mechanism, and this is very dear to me because I studied this mechanism before I came to Arizona when I was a professor of neurology and pathology at Jefferson Medical School in Philadelphia. I studied this pathway because the olfactory nerve, which allows us to smell, and the vagus nerve that allows us to taste, can be pathways by which the virus can enter the brain, particularly the olfactory nerve, the one that goes to our nose and allows us to smell. And I'll explain to you later on, because I did some good amount of work on that pathway. So this is how the brain gets damaged through the blood when the lung fails and through the nerves. And I'm going to show you how the virus goes into the nose and infects the brain. Many years ago, before I came to Arizona, we found out that my patients with Alzheimer's disease were eating a lot of sweets. Those of us who have taken care of patients with Alzheimer's disease, we noticed that they prefer to eat a lot of sweets. It happens that part of what we taste depends on what we smell. That's why when you have a running nose, you're congested, you don't taste well. So my team and I started looking at the smell in Alzheimer's disease. And we published this, and look at this, in 1993, many years ago. In Alzheimer's disease, they lose their sense of smell, many of them. So now the virus comes in, it uses the same nerve that goes to the brain. This is the nerve, comes to the nose, and look what happens. It enters the brain and circulates. And that's how the virus also, there's another way by which the virus enters the brain. So there are three ways. So once it's inside the brain, what happens? Well, the virus attaches itself to brain cells. And look at this. This is the brain cell, and it attaches to a receptor, what we call the ACE2 receptor. And through this receptor, it enters the brain, and that's where they multiply, they replicate so many times to the point that the cell will die, and then they will reinfect other cells. All right? So then the patient may suffer from meningitis or encephalitis. So in the clinical situation, when we take care of patients with suspected or confirmed cases of COVID-19, we have to look into the possibility of our patients suffering from encephalitis. Or they could be what we call toxic encephalopathy, which may be caused by lack of oxygen, some infection, and failure of different organs. The heart fails, the kidney fails, then they all affect brain function. We're finding out too that some patients develop stroke, or what we call cerebrovascular disease. Their platelets that are cells responsible for clotting may not work. Or they may have infection of blood vessels, what we call vasculitis, and again, cause stroke. Now, at least I have seen one patient who had Guillain-Barré, and this is a disease that affects peripheral nerves. They get paralyzed because the nerves are denuded and become and lose their myelin sheath, which is a covering of the nerves. And for some reason, it's in certain infections like COVID-19, they could denude the nerve of its covering. Let me then show you how it looks like in clinical practice. This is a brain, for instance, where the lungs failed, and look at this brain is swollen. There's some blood in it. And if you look at the brain itself under the microscope, you can see all this inflammation. And look at this, the cells are very few and they're swollen as well. We look at the MRI and look at this all damaged brain cells, very diffused. And this black dots here may be blood because some of them bleed. Yeah. Other cases are like this one. If you look at the blood vessel here, these are normal blood vessels, smooth, thin blood vessels. And look at this here. It's like a string. You have areas or segments that are very narrow. That means that the blood is not flowing there anymore. So what happens? Patients develop stroke. And this is indicated here by these arrows. All right. So all over the brain, can be strokes. And that's what we call vasculitis, meaning inflammation of blood vessels inside the brain. Now, so there are different types of strokes as well. Sometimes there's bleeding. Okay, you can see it here. This is blood in a patient who had a CAT scan. The blood vessels are inflamed, so they can easily break and lead to hemorrhage. This is another one that had hemorrhage, in the brain. And so in some patients, the platelets, the cells that allow the blood to clot are either reduced or they don't work well. So they can bleed. The patients can have bleeding in the brain. Now, in terms of nerves, this is an example of peripheral of a nerve that's damaged in COVID-19. This is the membrane that covers the nerve, the tentacle of the nerve cell. We call the axon. In Guillain-Barré or in multiple sclerosis, this myelin sheath is destroyed. And that's why in MS, you have all these white spots, meaning the nerve cells are damaged. And this can happen in COVID-19. In the same fashion, in the peripheral nerves, patients can get paralyzed because look at this. This covering of the nerve is damaged, so it's denuded. And that can cause paralysis in patients with what we call Guillain-Barré. And it can be acute or chronic. So why do some patients really get sick and some get mild symptoms or no symptoms at all? Well, our response to infection is determined by the competence of the immune system and the degree of reaction of the immune system. And we talk about the overreaction or overdrive, that's dangerous as well. So it has to be appropriate reaction to the offending organism. How about general medical status of the patient? Does the patient have hypertension? Does he have heart disease? Does he have liver disease? That will influence our body's reaction to the infection. What are the risk factors? I'll mention some of this later on. And genetics. Is the immune system competent? Because some patients have genetically linked disorder that influences the immune system. And these are just some of what we know as risk factors. The age, we know that patients older than 65, the immune system doesn't work as good, so they are more susceptible. Patients with COPD or asthma, diabetes, heart disease, hypertension, smoking, blood type, but this is being challenged, and this may be this may not be a risk factor. Obesity and genetics. Now, just to give you an idea how the brain works, because it's the only organ that is quite complicated and the most complicated, as a matter of fact, and the most protected organ in the human body. All right. See, you have billions of cells working 24/7, 365 days. They don't rest, even if we're sleeping. They're communicating with each other. If this brain cell is damaged and dies, its connections also will degenerate in time. And you can see here, if this is a dead brain cell, look at what happens now. There are no more connections. Because, so it is truly a network. It is the most complicated computer system on Earth. Okay, so it works as a team. And that phenomenon, when the brain brain cell is damaged, and then it causes degeneration of the cells that interact with that particular damaged cell, what's what we call transsynaptic degeneration. And that's why At the beginning of the pandemic, I've been calling my colleagues and reminding them that this process could lead to long-term complications because this does not happen overnight. It happens after weeks, months, and years. All right. So the brain is easily damaged, but very slow, and may have and has limited regenerative capabilities. Now, what are the long-term complications that we have seen and we expect to see? If you look back at history in the pandemic of 2018, years after, there was an increase in the number of Parkinson's disease and schizophrenia, particularly in the Midwest. Many of the doctors who saw these patients think that there were complications of the pandemic in 2018. I have seen now a few patients who have complained of brain fog. I have patients who mimic the symptoms of Parkinson's disease, become depressed and anxious. We have inappropriate behavior, and now we have patients who may even develop seizures. Weakness may persist, as well as numbing and tingling, indicating that the nerves are damaged as well, and their strength may not come back to normal. All right. So we have to be aware of this phenomena if we truly have to care about these patients. So it's not a one-shot deal. It will not happen to every patient, but we need to be aware that COVID-19 can have acute and chronic complications of the nervous system. Now, with the pandemic, we learned a lot about this disease. And here is a major breakthrough, is the vaccine. The reason why we're able to develop a vaccine very quickly is because of our investment. The United States, our country, invested a lot of funds to create the Human Genome Project. There are other countries that help, but by and large, most of the funding, or the largest funding, came from our country. Because of this, we can identify the gene of proteins and organisms in a very short period of time and develop a vaccine against that. So vaccines used to be very difficult to develop. It took years to develop. Remember, polio vaccine took years to develop. Now it took months only to develop vaccine. But everybody who is eligible should take the vaccine. And this is how you explain this, okay? In very simple terms, this is what you call herd immunity. What is this herd immunity? It is a condition when enough of our fellow Americans are immune to the infection, either through infection, natural infection, or vaccines. And because of those vaccination and natural infection, those individuals develop antibodies that give them immunity. Then look at the right side here. The red represents infected individuals. The blue are susceptible. In the beginning of the pandemic, this is what happened. There's no protection. So these are the carriers, and boom, 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 they got all infected. Now, with vaccination, look at what happened. This is the infected. These are the immunized patient, either through infection or vaccination. And look at the susceptible individuals are protected, because this one cannot go to this without going through this. But this has antibodies that will neutralize this COVID-2 virus. So this is called herd immunity. But believe me, the story goes beyond this. Herd immunity was actually taken from the observation that buffaloes surround the adult buffaloes surround the young buffaloes so that they don't get hurt. So that's why it's called herd immunity. So in summary, just to remind you that the nervous system can be involved early on and later on in COVID-19. And these are the symptoms that we look for and we should look for. And we have to thank our government for investing in the Human Genome Project. Thank you very much. I will be glad to answer questions if you have any. Any questions? Hello?
I'm monitoring the chat box right now. No questions that came in so far. Everyone is saying thank you. Someone did ask, if someone has had the virus, can they get it again?
Of course, yes. That's why even after viral infection, we suggest that they should be vaccinated. The reason for that is we don't know how good the immune system was in terms of producing antibodies, how long the antibodies will last. So there's a possibility that this patients who have had COVID-19 can be reinfected. They will have some memory cells, hopefully, that will attack the reinfecting virus, but we don't know that.
Another question was, what is the percentage needed for immunity?
What do you mean? Herd immunity, you mean? Or immunity per se? We don't know how our immune system and how much is necessary, because it also depends on the load, on the amount of viruses that are circulating and are affecting different organs. So we don't have an idea of how much immunity is necessary. We know that when we are vaccinated, we produce antibodies against the virus, and that will, if ever we get infected, it will be much less severe, or we are spared from being infected.
The next question is, does neurofeedback help rework damaged pathways in the brain?
I'm sorry, does what? I'm sorry?
Does neurofeedback help rework damaged pathways in the brain?
We don't know that. We are still learning about the virus here. All the interventions that we have may have a role later on, but we do not have the data to support that. But I think as we learn more about these patients, we could certainly determine whether that is effective.
And we have one last question. Any ideas how long the symptoms can last?
Which system?
Symptoms.
Oh, the symptoms. Okay. Oh, again, it depends on the, this is the equation. It depends on the response of the body, like the immune system. Is it competent or not competent? It depends on the general status of the patient. It depends on the amount of or the number of virus particles that infect us. And the balance or the difference between the two will determine the duration of symptoms. In the younger age group, we know that the symptoms may be mild or shorter. And in the older patients, symptoms may be more severe and may last longer. Okay, I have patients now who have had problems with brain fog, for instance, and tremors started after COVID-19. So we're observing. We need to monitor this because we are just into the second year of the pandemic. And as I alluded to, it took a few years for Parkinson's disease to be considered as complications of the pandemic in 2018, as well as schizophrenia. So we need to be aware of these possibilities: depression, anxiety, even suicide, and dementia, problems with memory and comprehension. So, and particularly the elderly, it is a challenge when I see patients in the elderly who had COVID-19. Is how do you determine the difference between the effects of, say, early Alzheimer's disease versus COVID-19 damage? So we really need to examine these patients very carefully.
Right. Thank you, Dr. Reyes. We are coming to the end of this session. Thanks everybody for the questions. We're now moving on to the next session. And you guys have a good day, okay? Thank you, doctor.
Thank you. Mhm.